And
Right.
what we did was we used uh, recently imaging using the cold thermography. This one, you have this special devices which looks at the heat map. Rushad has been working something similar. We work. It's quite interesting when you put it and how the temperature changes. And we have seen that the temperature in the first 3 4 hours is maintained well with the contact lenses. That's the time when all this channel starts functioning. So once you knock it off, then it doesn't go to the same level as before. So your pain does not, even though the temperature, once you put contact lenses, we have seen that it maintains the temperature close to 2.5 hours. Yes, we the temperature is gone, but what happens is in when you put this is all your receptors, which actually triggers the pain. You put it in, the receptor is dampened. Even if you take the lens out, it is already dampened here. So that is where it is important. It's not that cold is going to be forever. We know the temperature is, say, once you hit the ocular surface temperature, it changes. For them, we put the drops. We can use one of the ketorolac drops on them. You can change the lens again. We do it sometimes. When they come back the next day morning, we change the to cold. Whatever we change, the cold contact lens is always cold. So irrespective of when you change the same day, what harm are you causing? Nothing. In fact, many of our patients who are not, forget about the bandage contact lens, those who are not tolerant to lenses, you tell them to keep the lens in fridge and use it every day, the daily disposable, the tolerance is very high. People who come back to you saying that we can't use those lenses. In fact, it's 100% they become tolerant. Cyclosporin drops, which you normally patients are not responsive, they don't like using, it stings, irritates, you keep it in the fridge and use it. Cold dampens everything. Thank you. My talk today is on customized lasers for complex corneas. These are my financial interests. When you look at customization, there are two important aspects of it. One is, uh, when you look at those 10 commandments, one is having a robust diagnosis, another one is using a thinking machines. Most of the customization needs to be taken care from the how your cornea is shaped, the way it's made up of, with this astigmatism, the whole mix of aberrations. What is important is the customization should start from the epithelium itself. And epithelium itself has the Zernike parameters. It has a normal epithelium will have absolutely no cylinder in it and perfectly normal corneas. But when you have a irregular epithelium, the whole customization becomes more challenging because the lasers are not meant to work on an irregular surface of epithelium because there are multiple curves on your epithelium, and that's one of the major challenges we feel when you have a quality of when you look at the quality of vision post surgeries. So understanding cylinder is very important because cylinder is just not a component of geometrical x k1 k2. It's a mix of multiple axes which is hidden because most of those axes are driven by your aberrations and multiple other factors which you cannot correct with the glasses, probably rigid contact lenses, but not with the glasses. The topo guided treatment is all about making those imperfection right. The wavefront optimized is all about just one. It just follows a Muller-Lin formula and just looks at one ablation pattern compared to what you do on a topo guided treatment. The different type of customization is topo guided, which is anterior surface of the cornea, and but your posterior surface is not taken care of. And in a wavefront guided, it's a complete system is what is looked at. There's a very old slide from when customization was introduced in for the wave light. They spoke about the topo guided treatment in irregular corneas when your aberrations are very high. You can look at total aberrations are too high. You look at the wavefront guided, and when there is everything is perfectly normal, you don't touch the cornea and unnecessarily do anything, and then you look at wavefront optimized, which is a non-wavefront guided technique. So today the concept of contura came in because you are worried about this. Significant 40% of your patients form in this category where your cornea is filled with many aberrations patterns. So when you treat those aberrations pattern, you need a customization, and that is the first level of customization what we see in a healthy normal corneas. Schwinn PRK is one of the most highly driven customization we can think of, because it takes in data from your topographies, from your epithelium, and it's fed into the system. There are two types of customization here. One is a corneal wavefront, which uses a cirrus. Other one is a total wavefront, which is an ocular wavefront. And these are what we call it as aberration free, the custom corneal wavefront, the Presby Max, which is your corneal, which is your laser vision correction for presbyopia. The pattern of ablation is all driven by the epithelium. One of the biggest customization is ability to treat the periphery and the center, and the subjective correction is entered here. And you can compare between which one is better and what is the ablation profile, whether the cornea is better or a total I want to do. And you can see the maps here, and you can check what ablations, how much depth of ablations you're driven. So you need, it's a true form of customization to choose between the both. And then you can go to manager, play with these things which no other machines in this world can do it. You can choose the aberration you want, you can delete what you don't want to correct, and the machine itself will help you to correct or delete these aberrations. And by doing it, what you're trying to do is you're trying to give a person a more uh, tissue saving, which you probably would not see in your regular ones. A lot of this customization helps in remodeling, and the major area where the customization work is in the topo-guided treatment. When you're looking at both the custom wavefront or the ocular wavefront, and here the big thing is that you can place these two images side by side, and when you do a side by side, sometimes your corneal wavefront actually is burning more than the ocular wavefront, because what happens is your lens is compensating around 80% of your corneal issues. So if you have, when you look at customization, and if you have only one machine, then you virtually are driven to treat everything on this platform. But when you actually have the total corneal wavefront measure also, you see that your ablation is just around 9 microns compared to what you see here. And this is something which is a huge impact, is because the ocular wavefront negates a lot of corneal issues, and it makes your ablation much different. For example, if it's a cornea wavefront treatment, there's so many aberrations trying to treat. Why is trying to treat is because it assumes that everything which is happening in your eye is from the cornea. But minute you do ocular wavefront, half of what was treating it actually deletes it. Why does it delete it? Because it says that the lens is compensating. You don't need to worry about all this ablation. When you delete this, your ablation actually drops down. You are reducing it by around 17 or 20 microns. 20 microns get just completely deleted there. That's the big difference between the ocular wavefront and the total wavefront. And one of the advantage here is what the cornea was treated as 4 diopters, 4 microns, that is 5 diopters of coma was treated if you assume that cornea is the only optical system in your eye. But when you do the ocular wavefront, it only treats 1 diopter of coma, because the other 4 diopters of coma, the lens is accommodating and it is negating the coma itself. So it's a huge advantage in customization is, if you do Alcon or any other machine, it would treat 5 diopters assuming that everything is coming from the cornea. It will miss the lens completely. So unnecessarily you will be burning 5 diopters of coma will be treated, and you'll be burning a lot of tissue, what you see here, as 24 microns. And here you're burning only 1 diopter because 4 diopters is using the accommodation. Accommodation is already taken care of it. And that's one of the reasons the true customization is when you use the whole ocular wavefront. And this is a classic video here which explains this, that how the lens, this is a accommodation of a lens, and we can just see how the lens is accommodating here, and it is accommodating exactly similar to what you see on a topography, exact same thing. This is from an Osiris. As the patient is accommodating, you can see that now it matches your topography. It's matching the topography because that is what is giving you this 5 diopters of cornea is matching. So it is 4 diopters of this just goes off with just accommodation. So that is one of the big reasons why the total, why this is very important in understanding a customization of lasers. And these are a few examples how we treat, and few examples of the pre and post ops. And there are times when corneal wavefront is better because the lens is over accommodating, so you end up in having more challenges. But here you can see that you can choose. The true customization is choosing what you want to choose for your patients. And sometimes when everything is bad, then that's a challenge of what we call it as trek. This is something which we can do it on Schwinn platform, and you can create a small PTK at the zone where the cone is, and the rest of the area you can manually remove it, and you can do a cross linking. And the PTK is just around 10 microns more than the epithelial thickness here, and that's something which we have given out here. And of irregular corneas, like these are the patients who would come to you for cataract, but they have an RK, very bad corneas, and you can regularize them, and post regularization, now you can think about any premium lenses also if you want to, because your cornea has become more regular, even with the very, very bad stigmatism, a very, very bad scarring. There are a lot of scarred corneas, and one of the major interests for me in treatment of a customized laser is scarring. I get a lot of this scarred ones. This is a patient referred to me who had maybe a buttonhole or a loss of flap, and the doctor said he was not sure. So it looked like there was a scar in the center, and she was very unhappy with this thing. And this is one more patient who looked like had a similar kind of a pattern, and this is how it looked. And this is how you can do you can't do a PTK because there's some areas in between the scar which looked healthy. So you can build some custom laser approach, and using the CW platform, make the zone smaller, take out aberration what you don't want, and then you just see the pattern. The pattern of laser is exactly what, sorry, wherever there's a bump which is flat, it's trying to make it steeper. Wherever it's steeper, it's trying to make it flatter. It's a very beautiful way of even treating scarring. That means this area, it made it to bump more, and this area, the bump, it reduced. And this is what we looked like. And you can see that the scar completely disappeared. And if you look at the OCT here, this area had already, which was very greater, has bumped in, and these two areas had gone in, and this is the aberrations at this point of time. And I've discussed about the trek, and I can just, and I think this is also a similar case where we use the same trek for this procedure. I think there's some. And this is exactly one more case where we created the same scarring in that areas was corrected. Thank you. I'll just stop here for the interest of time.
Thank you, sir. So if you would like to give one tip at the end of the talk, what would it be for everybody in like?
The one tip is play with your machine as much as possible. What the companies tell you, they only tell you 1% of what your machines can do. And whenever you travel, visit, meet people, figure out, everybody would have picked up one. Sir would have picked up one. Saura would have picked up one. I think if you really pick up one, it'll be having more uses than what the companies would say. And none of these were part of what the companies say. Some they were very rigid of what you can do, what you can't do. Thank you.
Thank you.